Ngayon po ay pag-uusapan natin ang patient privacy. Ito po yung isa sa mga naging issue at mainit na pinag-uusapan sa social media feed kamakailan lamang.
Yan po yung matapos may mga kumalat na video ng paglabag dito at kumalat ang impormasyon ng pasyente nang walang pahintulot. Alamin natin ang mga batas tungkol dito at ang karapatan ng bawat isa pagdating sa ganitong sitwasyon. Mula muli kay Dr. Via Roderos Galvan, isang general physician. Doc Via, good morning. Welcome sa Rise and Shine Pilipinas.
Good morning.
Good morning, Prof. P, Sir Audrey. Good morning po sa lahat ng ating mga manonood.
Okay, para sa kaalaman po ng ating mga kababayan, Dr. Via, ano po ba ang ibig sabihin ng patient privacy and protection at bakit po ito mahalaga sa mga pasyente?
Okay. When we talk about patient privacy, isa itong mahalagang component ng healthcare wherein we protect yung mga sensitibong impormasyon about our patients. Under this particular premise, may dalawang sinusunod kami na mga guidelines.
Okay.
Especially for us, sa ng mga doktor, we have our code of ethics for physicians. Na ang nakasaad doon, especially doon sa Section 2 ng Code of Ethics natin, lahat ng impormasyon na binibigay at bino-volunteer sa inyo ng patient is sagrado.
Okay.
So you should treat it with utmost respect and confidentiality. Kasi yung mga impormasyon na to was given out of trust sa inyong relationship as doctor and patient. And another law or another guideline that we abide by, especially when it comes to patient protection, is yung Data Privacy Act.
Okay.
Actually, our Data Privacy Act provides protection for our patients. So ang data privacy po or ang patient privacy and protection pertains to any sensitive information that should be protected with regard sa ating mga pasyente.
Ayun. Doc, I just have a clarification kasi you mentioned code of ethics, diba?
Yeah.
Although it's ethics, it's just a moral philosophy. Ibig sabihin, we're going to follow it. Pag hindi ka naman pwedeng maparusahan. Pero on any cases, we're talking about the code 2, meron ba naka-angkla na batas din dito or is the data privacy ang pwedeng tumutok dito?
Yeah.
Para magkaroon ng punishment?
Yeah. It's good that you brought up yung code of ethics natin, Although walang criminal liability doon, pwede pa rin you'll go under, of course, the scrutiny of PRC. May mga regulatory board kasi yan, Pwedeng magkaroon ka ng administrative case, Pwede ring magkaroon ng chance na mawala ang lisensya mo because of it, But in terms of criminal liability, our patients are protected actually by the Data Privacy Act, which also entails yung mga penalties if you have breached the sensitive information or depende on what kind of breach yung nangyari.
Which is what we call the privileged or should I say protected health information.
Yes.
What are the examples at anong mga sakop nito?
Okay. So when we talk about patient protection or protected information, we have to establish first doctor-patient confidentiality.
Ayun.
So ibig sabihin dito, lahat that goes and transpires between the doctor and the patient is protected. So including yan yung identity mo as a patient, ano yung case mo, is there going to be a procedure that's going to be related to the disease that we are curing, So kaya, especially if you're not in the healthcare team ng isang pasyente, bawal po kaming mag-disclose even to our family members, even to our colleagues also, especially those who are not part of the healthcare team ng pasyenteng yan, because we are bound by not only by the code of ethics, but of course, patients are protected by the law,
Ayun.
Yeah.
Ito, to follow up lang sa question ni Fino, kasi hindi lang documents ngayon, doktora, meron na tayong mga cellphone na nabivideohan. For example, isang celebrity yung patient or high-ranking official sa gobyerno at lumabas ito sa public, At naging concern ng public at na-scrutinize in public yung kanyang...
circles.
So, anong labag din po ba ito sa Code of Ethics at saka sa batas?
Yes, so to err to the side of safety, usually, pina-follow natin that we have to protect the identity of the patient. Kaya usually sa hospital, palaging may mga reminders tayo sa mga pasyente na bawal po mag-video, bawal po ng pictures, because what the law, the spirit of the law is after is to protect the dignity of the patient, no? So, ideally, no, dapat, no, if for example may lumabas na mukha, no, may lumabas na name, no, usually po, hindi po ito dapat nangyayari.
Okay.
No? Because
So
of the
anything
data privacy,
that would concern the patient and the doctor itself, hindi pwedeng lumabas yan. Kasi under ito ng Data Privacy Act and Code 2.
Unless, of course, no, consent. Consent is important.
Consensual.
Of course.
Okay.
Okay.
How about yung medical history ng isang tao? Of course, kapag may tumatakbong opisyalis sa gobyerno, ni-scrutinize yung mga pinagdaanan nilang history, even yung health.
Dapat kasi masabi yun di ba?
So, paano po ito? Pag,
Usually,
ilalabas?
no, when we talk about medical history, no, it's under still no, the sensitive information no, that we do not have to disclose, no, especially no, if we tie it to an identity. So, for example, in the case of, for example, magpe-present kami ng case study ng isang pasyente, no, we redact the information no, about their name.
Pag-research naman, talagang hindi agad pinapangalan.
Especially, dapat may consent din.
Kung high-ranking official, siguro, dapat sabihin sa publiko, spokesperson.
Yeah.
Kaya media pwede magtanong. Joel, aside po, Doc, dun sa, dito sa mga doktor, sino-sino po yung mga kinakailangang sumunod sa patakaran itong tinatawag natin na patient privacy and protection? Lahat ba ng empleyado ng mga clinic and hospital? Ano po ang sakop nito?
Across the board po ba ito?
Yeah. Okay, so since no there is a law that protects patients, no, so it's across the board, no. So any healthcare professional no under the jurisdiction of
Kahit
a certain even interns po, especially interns, no, because no, one of the things that we usually teach our medical professionals, our medical students, no, before they graduate, bago sila gumraduate, is kalakip doon yung patient privacy. No, part yun ng medical jurisprudence natin na course that they have to pass no, before they graduate. So, including no, medical trainees no, have to abide by the law and have to abide by the code of ethics.
Alright, maraming salamat sa lahat ng impormasyon na ibinahagi mo sa amin ngayong umaga, Dr. Via. Muli, nakapalingan po natin si Dr. Via Arderos Galban para pag-usapan ang patungkol sa mga pribadong impormasyon sa mga pasyente. Maraming salamat, Doc.
Thank you.
Thank you so much.